Today, my name is Dr. Chude Ufondu of Snowspirations, Global Health Solutions. And thank you and welcome to today's 40s Fridays. 40s Friday is a very special clinic for very special people. You see, when you get to 40, life begins to change. Life begins to take different dimension. And from our experience, men and women in their 40s expectedly have seen the other side of life, expectedly are more matured, expectedly are more user-friendly. So 40s Fridays for our group is a very special clinic for women that obviously they've seen life has been mean to them, men that have done the right things and maybe unfortunately they are not able to start their family. So in next few minutes, we are gonna assemble and we are gonna talk about the possibility of still becoming a parent despite poor quality sperm. This is a problem that has affected so many families. Unfortunately, in the contemporary society, most problems are blamed on women, but that's not right. Infertility can happen to the most loving couples out there. Infertility can happen to the rich. Infertility can happen to the poor. Infertility can happen to the blacks. Infertility can happen to the whites. There is no boundary in infertility. In the same vein, infertility is 50-50. So it's not just a woman problem. Unfortunately, in our group, predominant of people we see in the group are women. But in our society, using Nigeria as example, it's 50-50. So the reason why you don't have a baby today can be from the man, just like it can be from the woman. In some situations, it can be from both the woman and the man. So we have to start paying attention. We have to start, doing the right thing, stopping the blame, being proactive, taking the right steps, going beyond praying, going beyond saying amen, going beyond wishful thinking. If you genuinely want to be a parent, it's time to take up the mantle of leadership and responsibility and check the right box so you can become. So this afternoon, we are going to talk about becoming a parent. That's becoming a father and a mother despite poor quality sperm. So we are going to hone in on the male aspect of infertility. Infertility can be male factor infertility. It can be female factor infertility. Now, in male factor infertility, it can be primary infertility or secondary infertility. In primary infertility, you were pregnant. In primary infertility, in your lifetime, while meeting with your partner, you've not been able to impregnate her. And you are still not able to impregnate her. Your girlfriends, your fiancé, and your current wife, you have not been able to impregnate any woman. Now, in secondary infertility, for the male, you were able to impregnate a woman in the past. But currently, you are finding it difficult to be a father. This is called secondary infertility. Now, top on the list of things that can make a man not to be able to become a father is the sperm quality. So the quality of your sperm is dependent on three criteria: the count, the motility, and the appearance. So the likelihood that the reason why you are not able to have your own baby today, it's coming from poor quality sperm is high. Now we have to understand this. So if you have been together in any capacity in your relationship and your wife or your female partner is 35 years and above, and you guys are practicing playing, which is making love 48 hourly, then practicing, that means you have a fertility specialist. If your female partner is 35 years and above, if you have tried this for 6 months, and you are not able to become pregnant, then you have infertility. If your female partner is below 35 and you guys have prayed, made love, and consulted a fertility specialist, and you are not able to impregnate her, you have infertility. So infertility is defined as the inability to become pregnant for a period of 6 months in couples that are making love consistently, if the woman is above 35, and a period of 12 months if the woman is below 35. This is what infertility is all about. So this afternoon, we are going to concentrate on how you can overcome the poor quality sperm so you can become. You see, my people, it's not a quick fix. We have to follow due process. We have to check the right boxes. And it will surprise you. Majority of the things you need to do, you might not even need to take any drugs. If you're a man, it might just be little adjustment in your life. It might just be attending this class. It might just be opening your mind to the knowledge you need. It might just be changing your attitude. It might just be changing the frequency of your lovemaking. Thankfully, in as much as men that have poor quality sperm, that means low sperm count, poor motility, and poor morphology. In as much as your chance of impregnating your woman is low, you can still become a father. So there are so many men who had poor quality sperm who are currently fathers. How did they become fathers? That's going to be the topic for today's discussion. So I want you to pay special attention. So low sperm count, which is kind of an umbrella description of everything about poor quality sperm, it's when you ejaculate. Ejaculate is what comes out from the penis at the peak of sexual intercourse, when it contains fewer sperm than normal. Now, this fewer sperm than normal is called oligospermia. Now, some men can have complete absence of sperm inside the semen. That's called azoospermia. Now, this is a very difficult condition. If it's properly confirmed that you don't have azoospermia, then you need to go for donor sperm. So if your sperm count is fewer than 15 million sperm per milliliter of the semen, then you have low sperm count. Remember, having low sperm count will decrease the odds that you will impregnate your partner and your partner will be pregnant and deliver your baby. Nonetheless, many men who had low sperm count are still able to father a child. Now the question is, how? So the fact that they've told your male partner that he's got low sperm count, poor quality sperm, poor count, poor morphology, it doesn't mean you should stop making love. The best way to still become a father when you have poor quality sperm is to still keep practicing your PPP. Now, I'm going to start with the risk factors. So we're talking about men. So there are certain things your men indulge in which can pose a problem, which can lead to poor quality sperm. These are likely habits, lifestyle, and the best way to overcome, to become a father, is to take a good look at yourself in the mirror. Look at the man you have become. Look at where you have been. Look at all the struggles you've been through. Look at all the stressors you're going through, the money you've been looking for, the whole efforts towards becoming a father. If this is what you envisaged for your future, for your generation, then you need to take a good look at yourself in the mirror and start becoming involved, becoming responsible. So what are those risk factors which can lead to poor quality sperm, which if you modify, you can increase the possibility of becoming a father? Number one, smoking tobacco. If you want to be a father, you don't have any business with any form of smoking. Now remember, smoking can be primary smoking or secondary smoking. If you are not lighting the cigarette or the cigar and smoking it by yourself, you might be smoking if you're hanging around friends that smoke. So people that smoke directly are people that are primarily smoking. But people that hang around people that smoke are also smoking. That's called secondary smoking. So avoid all forms of smoking. Make sure you keep the right kind of friends. The kind of friends you keep will determine the outcome of your life. Now, number two, majority of men drink a lot of alcohol. Today is Friday. It's possible that your partner is in the club. It's possible that your partner is in the pub. Now, it would be difficult for me to tell you outrightly to stop drinking, right? Now, you can gradually stop. My people, there is nothing we haven't experienced in this life. We are talking about lifestyle modification so you can start your family. So reducing your alcohol intake is very important. The other one, use of illicit drugs. In this era of abusing medication, abusing pain medication, abusing narcotics, and all those street drugs, especially in developing countries, when you expose yourself to use of illicit drugs, you are also increasing the possibility you have poor quality sperm, and you are likely not going to be a father. Now, the next one is very important. So many men are overweight. Majority are obese, outrightly obese. If when you married your man, he used to have 6 packs. Now his belly is so big that he can no longer see the penis. Matter of fact, there are some men that are grossly obese to the fact that the penis has been buried inside the fat. If your partner is in this department, please, your partner needs to watch the body weight. Now, so many men are running up and down looking for money, and at the end of the day, they end up becoming depressed. They end up becoming stressed. Stress is everyday thing. We need stress to be alive. We need stress to be up and about, but limit your avoidable stress. The stressors you have to face every day, face them. Avoid the stresses you don't need. So many men are going all over the place pursuing money. At the end of the day, they might get the money and they might use the money to go and pay the doctors. Think about going easy. Now, if you have current infection or past infection and it wasn't properly treated, things like chlamydia, things like gonorrhea or other infections, if it's not properly treated, it can reduce your possibility of becoming a father. So when you notice symptoms in your body, please make out time. Go and see the doctor. Don't go to the chemist. Don't start self-treatment. See the right kind of doctor. Let's have a diagnosis. Once we have a diagnosis, we can treat you appropriately. Let me give you an example. Sex is sweet, right? So it's possible you started making love in your 16 as a man, and in course of meeting different girls without protection, you picked up chlamydia, you picked up gonorrhea. Unfortunately, or fortunately, your immune system when you are younger can cordon off that infection, but you haven't treated them. It's still inside your body. So it can go to your body and go on vacation and be damaging things. And you might think you are free, but lo and behold, it has damaged your reproductive system, including the reproductive system of your wife or your male or your female partner. Now, PID is an outcome of untreated or poorly treated sexually transmitted infections, especially your chlamydia and your gonorrhea. Now, thankfully, if you contract chlamydia or gonorrhea and you present to a good doctor, within 1 week, we can give you specific antibiotics that can take care of it. Now, also avoid being exposed to toxins. So there are so many toxins in our environment, in our car, in our room, in our bedroom, in our kitchen, in our workplace. Avoid them. Now, avoid overheating your balls. This is where you need to be careful. When you want to go out, wear loose boxers. When you are done for the day, you don't even have any business for wearing pants. So discard your pants. Discard all those tight-fitting things. Why? The temperature of your balls, which is called testicles, it's hanging outside your body for spermatogenesis. So you are not supposed to increase the heat there. When you increase the level of heat in your testicles, you are reducing your possibility of producing sperm. When you don't produce sperm, the likelihood you're going to have sperm problem is very high. Now, if you experience any trauma to your testicles, to the scrotal area, let's say you were fighting or you got into sports, and they damage your testicles and you didn't go for proper treatment. Trauma to the testicles can damage your generation. The powerhouse of everybody listening to me today, if you're a man, it's your testicles. The most important part of a man's body is the testicles. Once anything happens to your ball, it's done for you. So the best place to protect in your body is your balls if you want to be a father. Now, unfortunately, some men are born with fertility disorder, or they might have blood relatives that have fertility disorder. So if your brother, if your father had infertility problem, the likelihood you might inherit it from them is high. So sometimes we need to deconstruct and look at the genetics. If you take some medical drugs, if you take some medications for diabetes, for hypertension, sometimes the side effects, the adverse effect can also affect your sexuality, which can also lead to problems. Some men can also have some medical conditions, including tumor, which is cancer, or chronic health conditions, which can affect your reproductive ability. Now, some men that have cancer, when we are treating cancer with radiation or chemotherapy, they can damage your reproductive system. Now, I've already mentioned some medications. Now, some men might have gone for vasectomy. So vasectomy is the process of going for permanent cessation of ability to impregnate a woman. So in vasectomy, what do? We clip the tubes that conduct sperm inside the penis. When we do this, then the likelihood you're not going to get a woman pregnant is very high. Now, some men might have gone for some abdominal or pelvic surgery. So you might have gone for appendix or hernia surgery, and if it's not done properly, it can damage your body. Now, some men can have undescended testes. So you see, the balls originate from the abdomen. In some men, when they were kids, instead of those balls to descend and go into the scrotum, it's hanging somewhere. This is something we need to discover early. So if you have a boy right now, make sure when you're bathing the boy, check the testicles. Make sure that both testicles are contained in the scrotum. If you notice that your baby boy, that the testicle is not in the balls are not in the scrotum, please take that child to a doctor immediately. Now, in medical practice, the biggest thing we can do to avoid problem is what? Prevention. I've already mentioned abstaining from smoking, abstaining from alcohol, staying off illicit drugs, talking to your doctor about all the medications you are taking. Medications can affect your ability to become pregnant. Maintaining a healthy weight, avoiding heat, managing your stress, avoiding exposure to pesticides, heavy metals, and toxins. So you can clearly see that the ability to become a father is solely dependent on basically attending to your external environment and changing your lifestyle. Now, what are the treatment options for men that have poor quality sperm? Number one, surgery. Unfortunately, some men can have a medical condition we call varicocele. When you have varicocele, the veins inside the place we call vas deferens, a tube that conducts the sperm, can be swollen, can be enlarged. When this happens, it blocks the normal flow of the sperm inside the penis. This can be corrected. Now, listen to me carefully. It's not every Tom, Dick, and Harry that should operate on your penis or your reproductive system. If you go to a quack, they can initiate castration, surgically induced castration. When they castrate you, you will become impotent. So if you are consulting a doctor, it must be a qualified, experienced, evidence-based urologist. So some men will need to go for varicocectomy. We need to correct that varicocele. Okay? So it's important we do this. Surgical correction of varicocele can improve your ability to ejaculate, and the sperm can be okay, and you can become a father. Now, so long as you're producing sperm, if it's obstructed, there are some men we can, give minor surgical procedure to collect the sperm, then we use it for IVF. That's an option of becoming a father. Now, if you have any form of infection, we need to treat it with the appropriate antibiotics. Like if you have chlamydia, gonorrhea, or even viral infections, we need to treat it properly so that we can restore your fertility. If your partner is having erectile dysfunction, premature ejaculation, and all those stuff, make sure your partner seeks sexual intercourse counseling Some of you will just need to, talk it out, engage in exercise, avoid stress, stop your alcohol. So pretty much everything I've been talking about. So if your partner has erectile dysfunction or premature ejaculation, he must seek help. Now, some men will need hormone treatment and medications. So if we find a particular hormone, like some men might have low testosterone. Testosterone is the sexual hormone. Testosterone in both the male and the female is what will make a man to make love to the wife, or what will make a wife to have libido. Libido means to have the sexual urge. So some men might have reduced testosterone. When your testosterone level is low, you will not have interest in making love. So when I tell you to make love every 48 hours, you will think I'm speaking French. So some men might need hormone replacement therapy, so we can bring up the level of your hormones that will help you to function properly. Finally, the last treatment modality is what we will concentrate on the 25th. So if you have been planning to go for IUI, IVF, donor sperm, donor egg, surrogacy, adoption, please make sure you register for our event on the 25th. Assisted reproductive technique is also a very important modality for treating men that have problems. In assisted reproductive technique, we are gonna check your sperm for the count, for the motility and the appearance. Then we will collect the sperm. Then if we are going for IUI, we are gonna inject the sperm directly into the womb. Or if we are going for IVF, we are gonna bring the sperm and the egg outside the body of the woman. Then when fertilization has occurred, we are gonna transfer it back. These are important options that can help you to become pregnant, even when you have low sperm count. So these are the basic things which we need to make sure that at the end of the day, we can still overcome infertility. Very simple, straightforward test. So what is the commonality? If your partner is having problem, he needs help. Now, if your partner doesn't present a urologist, how will we know that the problem is coming from him? So if your partner is attending today, tell him to go for check. If you have been planning to become a mother, you are 35 years and above, and you guys have been doing this for 6 months. At the end of the 6 months, both of you must see your fertility specialist. Your fertility specialist will refer your partner to a urologist. Then we'll begin to look at things differently. If you are below 35, 12 months, at the beginning of the 13th month, you escalate. The reason why I'm saying this is very simple. What you make a priority in life, where your treasures are, you put time and money there. If you genuinely want to be a father, this is not the time for blaming. This is not the time for pride. I am not surprised that it's only 30 people that are attending today's clinic, because it's not about soccer. It's not politics. It's not, multiple pregnancy. But this is the most important topic, because so many men are not participating in management of infertility. So many men are blaming the women. But this is your opportunity to get it right. Okay, so I'm going to collapse the clinic now, and I'm going to give you an opportunity to ask your questions. Okay, so the clinic is going to start now with asking your questions. If you need help, remember to follow admin. Admin will guide you. You can come in for one week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. If you are already pregnant, please register with our ANC. Don't even make mistake of going through your pregnancy alone. You need help. If you want to be a mother in 2022, make sure you join our Believing for Baby category. Now, if you are in these 2 group consults, is in Telegram. We have a window for asking your questions. So when you get there, don't just be a nominal member. Start asking your questions when the window opens, so you can glean from other people's experience. Everybody in our group is going to be a mother. Everybody in our group is going to be a father. But guess what? If you keep doing what you have been doing previously, you will keep getting what you've been getting. The first step you can take for me right now is to decide within yourself, is to join hands together as 2 loving couples and say, you know what, I'm going to join my faith with Dr. Chudi, and together we are going to defeat infertility. If you can do this together, you can overcome infertility. So this is the first step. You don't have to go your separate ways. You're attending a different thing. The man is attending a different thing. The man is going to the village. The man is testing girlfriends. You're just all over the place. Unfortunately, women are on the receiving end of all this, because men are more easily carried away to go and try their hands, and the culture support men to go and start making love with girlfriends to see if they can impregnate them. But when it's the woman, they will begin to blame the woman. But here's the deal. My sister, you are not a kid. You have to know when to tap out, because once you enter menopause, it's the end of the story for you. So you must go for help. If you have been trying by yourself and you are not able, we can help you. You can subscribe. When you subscribe, I will consult you. I will review your case. Then I will refer you. If you are in Nigeria, you have an advantage. Women in Nigeria, you have a big advantage. Admin is going to list the locations we can refer you. So if you're in Lagos, Abuja, Port Harcourt, Awka, Enugu, Calabar, Kano, Kogi, and all those places, we can refer you. Your infertility can end in 2021. You do not necessarily need to carry it over to 2022. 2022 is the dancing period. We have to all become mothers. If God gave you this, this is a beautiful gift. It's not everybody that God finds worthy to give a womb. If God gave you a womb, your womb is meant to be for your baby. Okay, your womb is for your baby. This is where your baby should be. Fibroid is not supposed to be inside here. This is where your baby should be. So if you are not doing the right thing, my sister, it's time to go back to the drawing board so we can get things right. So this is a reminder that you're a mother. If you have this, you are a mother. It's possible you're the one delaying. It's possible your partner is delaying, but this is a constant reminder that you're a mother. Let me introduce you to the various parts before I start taking questions. This is the vagina. This is the cervix. This is the entrance to your womb. These are your tubes. So every woman has 2 tubes. Then these are the ovaries. So these are the important organs in the body of a woman. This is the basis for everything we do in this group. If you have this, this is a constant reminder that you are a mother. In life, sometimes we can be delayed, but we can never be denied. God can never deny you motherhood, except you don't take the steps. This is why we preach, pray, play, practice. Every single time you have an opportunity, thank God. When you're done thanking God, go to work. Make love with your partner. No ovulation sex, no fertility window sex, no trying to figure things out by yourself. When you have done your best, let God be God. Let God take over. But when you haven't done your best, don't show up on 31st December when everybody is getting ready to enter New Year with good news. You will be crying. This is the best time for you to take your bold step. Allocate your resources. If God gave you the money, use the money, subscribe, attend classes, attend master classes, see the best doctor. What is the essence of money? If you can't use money to start your family, if you can use money to buy cars, to buy big houses, to attend shows, so many people wasted money. I was watching so many videos, yesterday. One of the guys that was burying the mother, people were spraying money all about fathers, but they are impressing society. Some of them are not giving their partners money to go for treatment, but they are complaining they don't have money, and you are trying to impress people that don't care about you. This is misplacement of priority. The problem we have is ourselves. We misplace our priority. We focus on things that don't matter. I'm talking to the men. Some of you are not listening. If you had done the right things, your partner would have been a mother of so many babies today. Stop displaying ignorance openly. Stop impressing people that don't even care whatever you are. Whatever amount of money you have is in your pocket. But we focus on so many silly things. So many of the women copying and pasting all those silliness. They don't have their babies. But you spend your data on silly things. It's time to think. It's time to think. You will blink and you go into menopause, my sister. And that's the end of the discussion. Ordinarily, I would have ended the clinic. My clinic is normally 30 minutes, but it's weekend. I'm home. I have, little leeway. So I'm still going to give you an opportunity to ask your questions, okay? So let's quickly take care of your questions. Okay, let's go. Please ask your questions now. The clinic is open. Make sure you register for the upcoming symposium. If you're planning for IVF, if you're planning for IUI, if you're planning for donor egg, donor sperm, surrogacy, adoption, please register. We have a 3-man panel. We have an IVF specialist. I will be there. Dr. Ndiche will be there. So you are not going to lack. If you are planning to go for IVF, don't go alone. You need your knowledge. If you're planning to go for IUI, you need the knowledge. If you're planning for surrogacy, you need the knowledge. Some of you already canceled IVF. Meanwhile, you don't know anything about IVF. How can you avoid something you haven't even researched? So this might be a good opportunity for you, okay? Dr. Ndiche is in the house. Thank you so much. So guys, ask me questions. Now, if you're in Oka, Abuja, Asaba, Benue, Calabar, Enugu, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, Owerri, and Port Harcourt, we can refer you. Okay, so if you need help in all the places I mentioned, we can refer you. Okay, if you're outside Nigeria and you have a need to go to Nigeria, we can refer you. The IVF specialist, which will address us on the 25th, is resident in Lagos. Is about the best IVF provider in Lagos. There are so many of our members in Nigeria currently waiting to come back to US, to London, to Canada. They've gone to Nigeria. They've done their treatment. They are pregnant. After 14 days of going for your embryo transfer, there are so many of our members that had embryo transfer yesterday, at least about 3. Now our 14-day countdown is on. Nothing can stop you from becoming a mother in 14 days. By the special grace of God, who made heaven and earth, I'm saying this openly, for you to have stepped up, for you to have yielded, for both of you to have come together, and you eked out that millions, and you went ahead, and you did the IVF. Mercy will meet you halfway. Grace will meet you halfway. You are not just going to have one baby. So many of you are going to have twins. So many of you are going to have triplets. And we are going to celebrate another quadruplet in this group. So we are counting down to 14 days. And these 2 shall pass. Thankfully, these are women that have helped other women. For the past 3 years, they have constantly contributed to women they don't know. They every month donate money to help people to go and get the help they need. These are the same women that God is remembering. And God will give you double for all your trouble in this group. Okay, so guys, let's talk. Let's talk. Ask your questions, please. Okay, let's talk. Let's talk. Okay, let's see. Is 30% active sperm okay for getting pregnant? Now, what you're doing, my sister, is actually not the right thing. Okay? Now, 30%, I don't know if it's 30% mortality. I don't know if it's 30% appearance. So this is deadly. Do you know why it's deadly? I don't know your whole medical case, right? And you're not supposed to share your medical history openly because you can actually be in trouble when you go home. You don't share your partner's seminal fluid analysis openly. So what I will advise you, my sister, follow my admin, subscribe. When you subscribe, I'm going to ask you a lot of questions. Then you're going to submit your report. Then I'm going to review. Now, 30%, assuming it's 30% mortality, assuming it's 30% appearance, you can still get your partner pregnant. So remember, the fact you have low sperm count, the fact you have poor mortality or poor morphology doesn't mean you cannot. The only men that cannot get their partner pregnant are men that have azoospermia. So the question is, when you have 30%, it means that 70% is abnormal. So assuming we are talking about the morphology, that means 30% is healthy, but 70% is unhealthy. Or if you're talking about mortality, that means 30% is forward moving, but greater percentage is not moving. But at least you have something that is moving. So you might be a candidate for IVF. You might be a candidate for IUI. You might be a candidate for ICSI. You might be a candidate for surrogacy. Now, for you to know what will work for you, we need to know your situation. So I will grossly encourage you to subscribe. Don't sit on the fence and feed on crumbs. With as little as 2,000 naira, you can come in for 1 week. We can crack your case. I can refer you. you can become a mother. We have had so many success stories. So many people come in, they think we are joking, they call me names, they abuse me. At the end of the day, they come in with their testimony. You saw the story of a 15-year infertility woman. She was among the people that carry my name about doing all those silly things. She later came back. She was apologizing. She practiced her PPP. Today, she's a mother of twins. So I'm not here to make you feel good. I'm here to help you to become pregnant. But please do the right things, okay? All right, guys, let's talk. Please ask your questions. Ask your questions. Dr. Ndiche should also be providing you feedbacks. So let me scroll up. Please, if you have any questions, this is an opportunity. This clinic is very important for all men having sperm issues. What factors affect sperm count? My sister, I've already mentioned this. Your lifestyle, your body weight, your hormone level, your activity level, your stress level, your medications. So any of the things I mentioned can affect the quality of the sperm. Any of the things. So if your partner takes alcohol, uses illicit drugs, not maintaining healthy weight, wearing tight-fitting pants, stressing, exposed to heavy metals, any of the things I mentioned can affect the quality of the sperm. Okay? All right, let's continue, guys. Keep asking your questions, please. Please keep asking your question. Okay, let's see. Is it possible for a man to be smoking and still have a good sperm? Yes, it's possible. But the question is, why do you want to do that? What are you smoking for? So the fact you are smoking and drinking doesn't mean you're not going to be a father. After all, there are so many smokers. There are some people that live in the club. Meanwhile, they have 15 kids. So where some people will succeed, you will go and you'll be in trouble. So the fact your brother, the fact your friend, they are smoking all the cigarettes in the community. They are drinking all the alcohol in the community, but they have 15 kids. So you're not comparing yourself with them. Guess what? You are wired differently. But what we know as of today is the fact that if you are smoking and you are drinking alcohol, it has a lot of deadly harm. So you don't need it. Especially if you are planning to be a father, you have to stop smoking completely. You don't need it. It's your enemy. Okay, guys, let's continue. Let's continue. Keep asking your questions. Like expected, very poorly attended clinic, because to you guys, it's not important. Meanwhile, this is the most important clinic. Okay. Guys, keep asking your questions. Keep asking your questions, please. Ask your questions. Ask your questions. We are talking about the possibility of becoming a father or becoming a mother despite your poor quality sperm. Okay? What is the cause of prostate in men? So my sister, every man has prostate, so that's not a problem. The problem is when the prostate starts getting enlarged or when the prostate becomes cancerous. So every man has a prostate, right? Prostate is a very special organ that actually participates in the process of sperm production and also in the normal function of a man. Now, for men, when you get to age 40, the possibility your prostate gland will start enlarging is high. It's called benign prostatic hyperplasia. Don't worry about the medical terminology. When your prostate gland is expanding, they will impinge on the bladder and the urine and every function that ordinarily should happen in your body. So men generally, as you are getting older, your prostate gland will expand and enlarge. Now, when it enlarges, you will have lower urinary tract symptoms. So if your partner wants to go and wee, they will have difficulties and so many things. So having prostate is a constant in all men. The enlargement of the prostate gland happens when you're getting older, from age 40. This is the reason why you have to make sure that age 40 up to 50, you at least go for your prostate check. Very important. Okay. Let's continue, guys. Keep asking your questions, please. Keep asking your questions. Okay, let's see. Okay. What causes vaginal dryness? Couple of things. Number one, lack of interest. Number two, age. So as you're getting older, the level of your estrogen will be coming down. So by the time you get to 35, there will be reduction in the level of your estrogen. Estrogen is the hormone that makes your vagina to be wet. So when it's coming down, the FSH will go up. FSH is follicular stimulating hormone. So they have a love-hate relationship. So when your estrogen is coming down, FSH is going up. When this happens, you're gonna be prone to having dry vagina. Now you might have infection. Okay? So infection, age, lack of normal function of your estrogen can cause this. Some women can have hormone imbalance. Some women can also have stress problems. So vaginal dryness, we have to investigate to know the origin. Now, if you have vaginal dryness, definitely making love is going to be painful. So you're likely going to have pain. You're likely going to bleed. You're likely going to have, excoriation. So you can have bruises there. So, but if you are functioning properly, like God designed you, when you and your partner are meeting each other, you are supposed to be ready for your partner, no matter the size of the penis. Your vagina can take care of the penis. But when you're not ready, when you don't know how to make love, you can share the PDF on sex. Sex is a topic that so many women don't know how to indulge in. And remember, you're supposed to be making love every 48 hours. So get the PDF and learn what you need to do about your vaginal dryness. You're not supposed to be having this, okay? All right. Let's see what we have, guys. Keep asking your questions. Keep asking your questions. If you need help, follow Onyinyechi, follow Chi Evelyn, follow my COO, follow Dr. Ndiche, and they will help you. It's a guarantee. But right now, please ask your questions. Ask your questions. Keep asking your questions, please. Okay? If you have questions, please go ahead and ask. I'll provide you feedbacks in real time. Okay. If you need help, follow the admin, subscribe, send emails, then I'm going to set you up. Please take action. It's July. July is the countdown. It's whitish discharge normal in pregnancy. Now, every woman discharges, especially in pregnancy. Your discharge in pregnancy is supposed to be transparent, so it's supposed to be clear. It's supposed to be like water. Anytime you have colored discharge, we need to investigate. So whitish discharge should be investigated. Colored discharge, greenish discharge, yellowish discharge, brownish discharge, blotting discharge must be investigated, especially in pregnancy. Okay? All right, guys, keep asking your question, please. Okay? What's the function of primulant infertility issues? So it's a type of progesterone. So if you're having progesterone issues, progesterone is the pregnancy sustaining hormone. So if your progesterone level is low, we'll likely give you this particular hormone related drug to help you make sure that your pregnancy is going to be good. So that's the function. Okay? Now, guys, let's take care of your questions. Please ask your questions. Please ask your questions. The clinic is open for your questions. Today, we're talking about the possibility of becoming a father or becoming a mother. Despite the fact you have poor quality sperm, you can still become a father. You can still become a mother, but you need to do the right things. If you don't do the right things, you're not going to become. You can be a prayer warrior. You can answer amen. You can romance all the post of the babies. If you don't step up, you are not going to become. This is not magic. The best magic and miracle you can do is to present yourself and do the right things. So when you pray, you make love to your partner. You cannot have a baby if you don't make love to your partner. The fastest way to become pregnant, capture this for me. The fastest and inexpensive way to become pregnant is to use PPP. When you pray in the morning, make love 48 hourly. If you do this, it's the fastest, inexpensive, most reliable method of naturally achieving pregnancy. But because we're in the society of quick fix, you marry in June. In July, you start running from pillar to post, taking clomid, damaging your body. Meanwhile, you haven't made love to your partner. Your partner is out drinking because he's boasting. So many men are boasting, I'm going to have 20 kids. Meanwhile, you're not doing the right things. You're damaging your body. This is not how God created us. God did not create us to drink all the alcohol in the community. God did not create us to be taking smoke, to be exposing ourselves to toxins, not to be exercising. So if you see a 20-year-old man, he will look like he's 50. That's not how God made you. This is not how your father gave birth to you. This is not how your grandfather gave birth to you. Go back to the drawing board. Watch what you eat. We swallow morning, afternoon, night, and we sit in one place. We don't move our body, and we expect miracle to happen. You cannot become that way. You must take charge. You must change your ways. You must allocate resources. Some of your partners are wasting money. Some of your partners are impressing people that are criticizing you. I know why I keep going back to this. Those videos I saw really pissed me off. You don't need to do those nonsense. It doesn't make sense. Who are you trying to impress? You can't provide money to your partner to go for fertility treatment. Then you're spraying money. You're showing affluence. Meanwhile, you're poor in spirit. Money is paper. Go and start your family, my brother. Stop that nonsense. Rearrange your priorities. Stop envying people that are doing the right things. Your friends are becoming fathers. The friends you're hanging around in the pub, the friends you have, they are fathers. What is your own problem? The people you're watching soccer together with, they are fathers. How did they become fathers? What help are you going for? You wanted to be fathers of twins and triplets. This is July, and you are not ready to go and seek for help. And you are blaming your woman. How can you become that way? It is not possible. You have to start showing up. This is not just a problem of women. You have to show up. Okay, what's the solution for menstrual cessation? Now, it also depends on your age, right? Now, every woman is going to get to that point where she will stop seeing her bleeding. That's called menopause. Now, this is what you need to do, my sister. There are so many things that can stop your period. So many. Stress, weight gain, weight loss, hormone imbalance, PCOS, ovulatory problems. So many. Now, how do we know what the problem is? You go to a gynecologist. But here's the deal. If you are older enough to hit menopause, if you haven't seen your period for a period of 12 consecutive months, and you are having low libido, and you are having dry vagina, if we take your blood and your FSH is high, and your estrogen is low, and your AMH is low, you have gone into menopause. What happens when you go into menopause? You have used all your eggs. When you go into menopause, when we come in here, you no longer have eggs. You have used all the 400 eggs that God gave you. So what's going to happen? You're not going to ovulate. So you don't have any eggs to release. When you don't have any eggs to release, you're not going to become pregnant. So what will happen to women that have used all their eggs? Can they still become mothers? Yes. What are we going to do? We are going to borrow eggs from another woman. And we are going to use it to help the woman to become pregnant. But every woman will use all her eggs. You are not like men. Men can have millions of sperm per sexual intercourse. But for women, once you have used all your eggs in your 2 ovaries, you have about 400 eggs. Once you are done with the eggs, it's all over for you. If you want, be Mary that sits by the side of Jesus Christ, or Martha on the other side. I'm a Christian, but I'm telling you your reality. We have to stop all this religious nonsense. You have to separate your spirituality from your reality. God made doctors. God gave me the knowledge I'm sharing with you today. Use your knowledge. Change your attitude to become. If you still have the opportunity to be bleeding, the possibility you're going to be a mother is high. If you are no longer bleeding and you're hovering around neighborhood of 40, it's possible you've gone into menopause. Some of you can go into menopause by next month. It might be ending of this year. Now, the question is, what are you going to do if you only have 6 eggs? Seek help. God can multiply your 1 egg when you go for IVF. It has gone before. It can happen again. But when you don't go, you will not know. Take your chances. This body you can see is beautifully made by God. This is the way God structured you to be a mother. Your partner must enter this vagina. Your partner must pour the semen, which contains the sperm. The sperm must go in, find any of the tubes, go to the ampulla, have the eggs come in, and fertilize the eggs. When the fertilization is done, they will come back and implant in the womb. This is the original design. God doesn't make mistake. If you have this and you are not able to be a mother, take your bold steps today before it's too late. If you go into menopause, go for donor eggs. If your partner doesn't have sperm, go for donor sperm. Go for IVF. Go for surrogacy. Some of the testimonies you're reading are from women that took both steps. 1 week ago, the two boys, the twin boys you celebrated with me is from surrogacy. She started with me. She did her best. She did everything possible. They could not have their own baby. What did they do? They went and did surrogacy. They are proud parents of twin boys today. Nobody can take their babies away from them. So my people, let's get this party started. Okay? All right. Okay, what's the cause of heavy liquid discharge after period with no smell? Like I mentioned, any type of discharge, copious discharge, colored, smelly or not, must be investigated. It can be nothing. It can be hormone imbalance. It can be hormonal imbalance. It can be infections. It can be anything. How do we know? You go to a gynecologist. Okay? So even if it's not smelling, so long as it's not your normal discharge, we need to know why. Okay. Okay, guys, let's wrap up, actually. Okay? Must all IVF women try mouth? No. My sister, you know, when you don't take time to ask your questions, I will confuse you. If I understand correctly, you're asking about sacrilege, right? It's not all IVF women. The only women who give sacrilege are the women that have cervical incompetence. So what you're trying to mention is what we call sacrilege. So some women can have disjunction, very weak. So this is the cervix. In some women, if disjunction is weak, we need to tie it with a special rope so that your baby can stay inside. When you are pregnant, we want your cervix to be closed. When you're not pregnant, we want it to be open so that the penis can release the sperm so the sperm can come in. So in all pregnancies, this cervix must be closed. If it's open or if it's unstable, we give you cervical sacrilege. So it's not all IVF women that will need cervical sacrilege. The women that will need cervical sacrilege are the women that have likelihood of cervical incompetence, whether it's through the process of your partner meeting with you or IVF. We are going to give you sacrilege. Okay? All right. What is the cause of abdominal pain on the right side that comes with heavy bleeding? Pain can mean anything. Pain is called non-specific symptoms. So it can be fibroid, it can be endometriosis, it can be gas, it can be infection, it can be PID, it can be anything, especially if it's coming with your bleeding. So if you've been having this pain lately and it's coming with your bleeding, the likelihood you might have fibroid is very high. So you must go to a gynecologist. We need to figure out what's going on. Okay, guys, keep asking your questions. I'm actually loving the questions. Admin, please check around and make sure all questions are attended to. Okay? Post all questions I haven't provided feedbacks on before I go. I have 7 more minutes. Please, correct. Let me share this. The fastest and inexpensive way to achieve pregnancy is practicing your PPP. If you see me, I'm Dr. Triple P. I love my Triple P. So pray, make love 48 hourly, then practice. If you can do this, you're going to be a mother in 2022. Nothing can stop you. Okay, guys? Okay, I've already provided feedbacks to this. Please ask your questions. Please ask your questions. For the past 1 hour, we've been discussing about the possibility of becoming a father or becoming a mother despite having low sperm count. You've paid for the forthcoming symposium. You can't wait. Okay, awesome. So if you've done the right things, make sure you send emails, then follow the link, and we're going to add you. So admin is going to take care of that. If you want to attend, register. It's on the 25th. Don't make the mistake of being over smart. Some smart people outsmart themselves. If you need help, go for help. There is a reason why I trained as a doctor. I went to medical school. I did my special training. So it's for a purpose. It's to help you. Put your money in the right place. Okay, guys, ask your questions, please. let's actually wrap up. If we are done with the questions, okay? Okay, someone is asking, what's the cause of tubal blockage? The commonest cause of tubal blockage out there is untreated PID. So if you have your gonorrhea or your chlamydia and you didn't treat it properly, they can go and damage your tubes. When they damage your tubes, they can form adhesions. Those adhesions can block the tubes. Okay? So when anything that affects the integrity of the tubes at any point. So if you notice, this end of the tube can be blocked, the middle can be blocked, this side can be blocked. So if this side is blocked, the air cannot come in. If this side is blocked, the sperm cannot come in. If this side is open and this side is open, the eggs and the sperm can come in. But when pregnancy happens, it will start developing in the tubes. It's called ectopic pregnancy. Very deadly. Now, some women might also have direct damage to the tube. Some women can also have very big fibroid that can impinge on the tubes and block the tubes. So these are possibilities that can lead to blockage of your tubes. Okay, what lubricant can be used to aid vaginal dryness? Pre-6 or baby dance. Only the two of them. Don't use your water, don't use your saliva, don't use your Vaseline, don't use your olive oil. Some of you will go to the church, they will give you olive oil and tell you to be drinking and be pouring inside your vagina. They are not friendly. But when you're using pre-6 or baby dance, they are sperm friendly. The problem is, imagine your partner having oligospermia. That means poor quality sperm, poor count, poor motility, poor morphology. Now you are using something that will kill the remaining sperm. It's called spermicides. So use your baby dance. Admin, capture this for me. Baby dance or pre-seed lubricants. You might not have it in Nigeria, but you can order it from Amazon, okay? It's very helpful. Okay, guys. Okay, ask your questions. Okay, let's see. Please, doc, on the case of azoospermia, 10 sperm were harvested for the testicle. Is the egg good for a woman to take in? My people, my sister Lily, if your partner had azoospermia means no sperm. So you can't say he had azoospermia and they saw 10 sperm. So that's not azoospermia. Azoospermia means no sperm. So likely what your partner might be having is oligospermia. Okay, so I can't tell you right now, oh, this is going to happen and this is not going to happen. It depends on the quality. Okay, so follow through with the person that is doing this. But like I told you, stop sharing your medical history openly. You might end up destroying your marriage or your relationship. Go and subscribe. Okay. Okay, let's wrap up, guys. 2 more minutes. 2 more minutes. Okay, let's see. Please, doc, what's the normal? Okay, you're talking about the nuchal rigidity. You know, that's something you can actually do. Go and subscribe. Send your medical report. We are going to review it for you. Okay? Please. It's beyond this particular broadcast. I'm not going to go into details. I'm going to confuse you. All right. Let's see what we have. Okay. Can one get pregnant with hormone imbalance? Yes. If you correct the hormone imbalance, you can get pregnant. What's the process of surrogacy? Well, this is the reason why you need to attend up the upcoming ART, meeting. So during that meeting, we're going to explain everything you need to know about surrogacy. But simply put, you need 3 people in surrogacy. You need a woman, you need a man, and another woman that will carry the baby. That's simply what surrogacy is all about. But attend the symposium. We're going to make it easy for you. You're going to understand it better. All right, guys, let's actually wrap up. I have 1 more minute. 1 more minute, then I'm done. Someone is asking about the right way to unblock your tubes. Unfortunately, listen to me carefully. If you have very mild blockage, when you go for your HSG, the fluid in HSG can flush that mild blockage away. Now, some women can have moderate blockage. They can go for what we call hydrotubation. But if you have severely blocked tubes, forget about the unblocking this and unblocking that. Just go and save some money and go for IVF. The problem with the tube, the more you're trying to correct the problem in the tube, the more you're creating more because the tube is very sensitive. So anytime you go in there for any procedure or any surgery, when it's healing, it will heal with scar tissues and it will keep giving you troubles. That's the problem with the tubes. So you need at least 1 open tube to become pregnant. But unfortunately, if both of them are blocked, then you need to go for IVF. So what a woman needs to become pregnant is one healthy open tube. But if both of them are damaged, you can still become pregnant, but you need to go for IVF. So tube, it's very important for natural process. But when your tubes are damaged and you still have your eggs, we'll collect your eggs, we'll collect the sperm, and you can still become pregnant. Okay? Let's continue. Okay, let's actually wrap up. My time is up. My time is up. Okay. So thank you for coming. And tomorrow is Saturday. Hopefully, I'm going to have my word round. And hopefully on Sunday too, we're going to have our maternal and child health clinic. Thank you for coming. Please encourage your male partners to participate. Please subscribe. Please get all the help you need. Continue praying. Continue playing. Continue practicing. If you are looking for a baby, you're going to get your baby. If you want to be a father, you're going to be a father. But you need to step up. Even when you're told you have poor quality sperm, keep on praying. Keep on playing. Keep on making love. God is on the throne. God will make you a mother. God will make you a father. But you need to step up. If you have the money, use it for the best interest of your family. Subscribe. Seek for help. Go for IVF. Go for anything you need to go for to start your family. If you need to downgrade from a big house, from a big car to one room and parlor, but you're a father, but you're a mother, do it. If you need to go and sell your shoes and so many things you're not using, things you're using to impress the society, but you don't have your babies do not have price tag, do it. If you need to borrow money, start your family. Your family is the most important thing that will happen to you. Okay, so God bless you and enjoy the rest of your day. I love you guys, and hopefully I will see you tomorrow. If I don't see you guys tomorrow, Dr. Ndiche will stand by until I see you guys. Thank you for coming, and God bless.